Well, it's a pleasure to welcome to Royal Free Radio Jon Spiers, who's the Chief Executive of the Royal Free Charity. So hello to you, Jon.
Hello, thank you very much for having me.
Well, thanks for coming up to Royal Free Radio. Now, you joined the Royal Free Charity fairly recently, right in the middle of the pandemic, I guess. It's always difficult starting a new job, but how did you manage with that situation?
That's right. So I joined in September of last year. If we think back, that's just when the second wave of COVID was beginning to rise. So the numbers in the hospitals were going back up again. It was a very strange experience. So I came into the organisation and was able to be in person meeting the team for only the first 2 days of the role. And then we had to send everybody home for 6 months. So I ended up getting to know the organisation remotely and trying to understand the whole swathe of different things that we do, getting to know lots and lots of different people across our hospitals and within the charity, which comes with a significant set of challenges when you obviously can't see people face to face.
Right. Now, you joined the charity, I think, with a lot of previous experience in health-related charities and organisations.
That's right. So my career in the charity sector has been about the last 20 years. I've worked for a whole range of different healthcare charities, from the very large ones. So I began my career with Cancer Research UK, the very, very big research organisation, and then more recently worked with much smaller charities. So my most recent role was running a small autism and learning disability charity. And I've worked alongside the NHS and with NHS charities in most of the jobs that I've done over 20 years. So I have a good understanding of the role that NHS charities play, but I'm really excited to be here now working as part of the Royal Free Charity team.
Now, the nation's always had a love for the NHS, I think it's true to say, but what's been the public's reaction to the NHS during the pandemic?
Well, I think, of course, everybody's been immensely grateful for the superhuman efforts that our staff have been putting in across the board, really, not just the staff in hospitals, but those in primary care and community care as well. I think we all remember those days of going out on a Thursday evening with our pots and pans, clapping and cheering the NHS. I think one really interesting result of the pandemic actually is a little bit of a shift in people's understanding of how they can support the NHS. So as a hospital charity, one of the things we've observed is often people didn't realise that there was a way that they could support the NHS financially. They were aware that there were often volunteers because they'd see them face to face when they came into hospitals. But actually this idea that you can donate, and Captain Tom, of course, played a huge role in this.
Right.
This idea that you can donate to the NHS and you can support financially those extra bits that the charities can offer, I think has been a real shift. And one of our hopes for the future is that we've normalised this idea of people giving to the NHS in the same way that they would give to, Guide Dogs or Cancer Research UK.
Right, and there are three, I think, main areas, if you like, that the Royal Free Charity covers from its funds.
That's right. So a lot of people don't always understand what an NHS charity does. So we exist really to do what the Exchequer taxpayer funding cannot do. So what we don't do is pay the salaries of doctors and nurses, but we're there to do all of the things that can't be covered by the money that the NHS receives from government. So we provide services directly to patients, whether that's our volunteers who are out there meeting and greeting, supporting the staff on the wards, running things like a radio station. We also provide a range of services to support patients perhaps as they're coming up to leaving hospital or after they've left. So we run a support hub that helps patients who might need extra help accessing benefits, for example, or support with housing. We run a whole range of different services which support staff through NHS staff, so for their health and well-being. We've got a recreation club at the Royal Free Hospital that we're very proud is able to provide fitness and health supports. We've been recently able to fund quite a wide range of mental health support. So one of the big impacts of the pandemic on NHS staff has been a real feeling of trauma and a real feeling of just how difficult it has been to get through the last year and a half. And we've been really delighted to be able to put in place a whole suite of extra psychological supports. And of course, we're a big research funder. So the Royal Free London Trust is a major partner of University College London. Huge amounts of research go on, particularly at the Royal Free Hospital, but across the whole trust. And we're really pleased that we're able to support those research efforts, sometimes by funding posts. So we fund lots of PhD students and lots of postdoc students, but also by funding specific projects in areas like long COVID, for example. We've recently funded 15 projects looking at the impact of COVID in a whole range of different areas. And we've got research looking into things like cancer, diabetes, and most recently we've opened the Pears building, which, as some of you will know, is in Hampstead on the side of the Royal Free Hospital. And that's not just a new home for the charity, but it's also the new home for the Institute of Immunity and Transplantation, which is Europe's largest centre for immunology research, and we are absolutely delighted to have been able not just to make sure that building was completed and the scientists moved in, but also to provide funding to some of the vital work that goes on there.
And that's been very much welcomed by the medical profession, I gather.
Absolutely. The Hans Staus, who's the professor that runs the institute, was telling me the other day he's getting phone calls from around the world from really well-known and influential immunologists who've heard about the Pears building, are really excited that there is a centre of that scope and scale in London, and frankly looking to see whether there might be a place for them there. So we're really excited about the future of the Pears building for driving benefits to patients.
Right, now you briefly mentioned volunteers earlier. You've got an army of volunteers, I think, who help in all sorts of ways at the hospitals.
That's right, and one of the big challenges of the pandemic, of course, is we've not been able to bring in as many volunteers as traditionally we've had across all of the hospitals. So in non-COVID times, we would probably have around 800 or 850 volunteers working, doing all sorts of different roles across the hospitals. When COVID hit, lots of those people unfortunately weren't able to come in. So for their own safety and the safety of patients, we had to reduce the numbers very substantially, and we're just beginning to bring volunteers back now. So our numbers are creeping up every day. We've got more and more people coming in. Some of them, by the entrances, meeting patients as they come through the door, helping them find their way. Others working on the wards, and we really excitingly were able to bring back our young volunteers over the summer. So we had a small group of young people, most of whom were interested in medical careers, and we were able to give them the opportunity across the hospitals to meet patients, to meet staff, to understand the experience of working in the NHS. And I'm really pleased to say lots of them are carrying on with us as volunteers, and will be working alongside the hundreds of people who've been able to volunteer with us over the years.
Is fundraising becoming more difficult in these difficult times, or is it slightly easier now?
Yes and no. I think, as I said before, one of the opportunities that the pandemic has created is a greater understanding from the general public that you can fundraise for the NHS. So I think there's a sense for a lot of people that now we're a cause they might consider alongside the other charities they want to support. That said, no charity managed to get through the pandemic without having a hit to their bottom line. So lots of charities not only found that their fundraising decreased, but often their costs and the need for their services increased at the same time, and we're no exception. So I think people are more aware they can give. I think people still feel that real love and desire to support the NHS locally, but we are competing with an awful lot of other causes. And of course, economically speaking, whenever people feel under pressure because the economy is not performing particularly well, that has an impact on charitable giving. So we're hopeful, we're absolutely optimistic that we can increase the amount that we can raise, and we can support more services, and we can provide more grants, but that's in the face of a very, very competitive, marketplace for charities, and an awful lot of other causes all trying to compete for the same money. So fingers crossed we'll get there, but I think it's going to be challenging.
Right. Now, we're always hearing and seeing that the medical staff in particular are exhausted, working long hours, worried about passing COVID on to their families at home. What's your observations of how the staff are? I
think for a lot of people that's absolutely right. I think certainly I talk to staff across all of our hospitals all the time, and I think exhausted is the word. I think they are feeling like they've just not had a break since the beginning of this pandemic. For lots of them, the way they work has changed very substantially. So many staff are now working, still doing lots and lots of face-to-face care with patients, but also trying to combine that with remote care. So we've really changed the way medicine is delivered across the whole NHS. Lots and lots of people obviously still very, very focused on COVID. So COVID, it waxes and wanes, I think, in terms of how the general public perceive it. But the reality is we have had COVID patients in our hospitals from the very beginning of the pandemic, and we still have them today. And those numbers fluctuate, but it provides an enormous challenge in terms of managing the flow of those patients and staff. Obviously, we need to make sure that the staff who are supporting the COVID wards are kept safe and are keeping themselves safe. But we're also trying to tackle the backlog of people who are waiting for routine operations and elective care. So people are very, very tired. And as I said before, I think one of the longer term impacts of this for the NHS may well be actually the psychological effect it's had. Of course, many staff have had COVID, and of course many of them have been left with some of its after effects. But actually for a lot of them, the pressure and the sheer anxiety that comes with working in this kind of environment for such a long period of time is very, very hard to bear. And that's why we've really prioritised that psychological care to make sure that we can keep people on their feet. We can make sure they're still there for patients when they're needed. And I think as things slowly begin to return to normal, we need to consider what else we can do to be supporting our amazing staff.
Right, now there's always plenty of events going on. If anyone looks at the Royal Free Charity website, they'll be able to see there's always marathons or skydiving or all sorts of things that they can take part in. But I guess the main thing at the moment is the Breaking Point appeal, which we're right in the middle of. Can you tell us something about that?
That's right. So one of the conversations that we had with the Trust recently was about this feeling of exhaustion and the need for us to do more to support both patients and staff. And from that came the Breaking Point appeal. In every conversation I was having with staff, people were talking about the feeling like they were coming to the end of their tether, that they felt under real pressure. And breaking point, I'm at breaking point, I'm nearing breaking point, was this phrase that we heard over and over and over again. So we worked very, very hard with the leaders in the Trust, with various clinical experts, to understand what can we do now that's going to make the biggest difference to get us through what is likely to be a very difficult winter. And what that identified is that there are a number of areas where the charity, through the funding that we get from our donors, can really make a significant difference. One of those is increasing the amount of support we're giving directly to our staff, both in terms of their physical health and their mental health. The second one is looking at the rest areas. So it's incredibly difficult being on your feet for an extended shift, and lots of staff find that actually when they get 5 minutes to go and take a break, or when they get to the end of a shift and they just need to decompress before they head home, there isn't anywhere for them to go and do that. We haven't got the space in the hospitals that could be staff lounges or just little rooms people can go and take a moment and collect their thoughts. So we want to create more of those spaces. One of the next things that we want to do is to help the staff who are working to try and reduce waiting lists. So we're looking at a digital innovation that will increase the speed at which we can bring people in for operations. So at the moment, lots and lots of work happens before you even come to the hospital for your operation. You've got questions that you need to be asked. You've got various things you need to work through with clinicians. And what we'd like to do is try and pilot a new digital intervention that will do more of that online. That means you're not having to come into hospital as often, but also we're actually speeding up the time it takes for you to come in and have your operation. And then finally, we've got a really exciting programme of work looking at the effects of long COVID. So in our hospitals, we've done lots and lots of work supporting people with acute COVID, so people who need to be in hospital because COVID's affected them so badly. But we're all aware of those stories of our friends and family and our loved ones who've been affected by COVID long after they've recovered from the acute disease. People who are fatigued, people who are finding that they've been left with breathing difficulties, people who are finding they've been left with mental after effects. And it's not a thing we really understand very well. Now, we've got a real strength in immunology and in infectious disease at the Royal Free London NHS Trust, and we want to build on that by funding a new programme of research that will look for a biomarker. So a biomarker is a thing that you can pick up through a physical test. It might be a blood test, it might be a urine test, but a chemical signature that you can detect which shows whether someone's got long COVID and perhaps how severe that long COVID is. Now, if we can do that, that gives us an opportunity both to improve the diagnosis of the condition, but also to start understanding whether particular treatments that we're offering people are making a difference. So we want to do a lot. The Breaking Point campaign cuts across an awful lot of areas, but every single one of those has been identified by patients and by staff as something that will make a really critical difference to them in the short term. And we'd be really delighted if your listeners and their families could help us in the appeal.
Right, so how's the best way that people can donate to the appeal?
So there's two really critical ways people can help. One of those is by going to our website, which is royalfreecharity.org/breakingpoint, and there you can give whatever you can afford to support the campaign. But just as importantly, we're running a new campaign within Breaking Point, which is on the Charity Extra crowdfunding platform. Some of you in North London will be familiar with Charity Extra. It's been quite popular in recent months with lots of charities. But in essence, what that acts like is a sort of just giving on steroids. So people who want to support the Charity Extra part of the appeal create a little team. So that's a team of you, your friends, your family, your colleagues at work. You work together to fundraise to a particular target, but we've got lots and lots of people all fundraising at the same time. So hundreds and hundreds of champions on the Charity Extra platform gathering money, and then all of that money gets collected together at the end for the final total. We're really excited that we've got some matched funding. So some of our long-standing donors have come forward, provided matched funding so that we can double the money that people give us. And if you go onto the Royal Free Charity website, you can see details of how you can sign up to become a Charity Extra champion. And that will be happening later on this month. So it's a very short acute period of time over a couple of days where people are asked to go out and talk to their communities, talk to their networks, and fundraise together, so that jointly we can put a really significant amount of money behind the appeal.
And also, I think if you go to the Royal Free Charity website, you can also claim the tax back as well.
Absolutely, yeah. Gift aid's a very important part of giving. Lots and lots of people are familiar with it. But yes, you have the opportunity not just to give, but also to make sure that you tick a box and you provide gift aid to the charity, which means that the government tops up what you give by an additional 20%.
Well, Jon, many thanks for coming along today to Royal Free Radio. Sounds like a very exciting time ahead. Let's keep our fingers crossed for lots and lots of donations, and wish you every success with the Breaking Point appeal.
Thank you very much for having me.
Thank you.